Nutrition, exercise, and other ways to maintain a healthy lifestyle are important for patients living with MS. Dr. Mary Ann Picone provides advice and strategies for helping patients achieve wellness in spite of their disease.
Hi, I'm Mary Ann Picone, Medical Director at the MS Center at Holy Name Medical Center in Teaneck, New Jersey. What do you think of when you hear the term aging? Gray hair, wrinkles, feeling tired, slowing down, balance being a bit off. And to think of a patient who has MS, who is getting older, those challenges can be amplified because of the difficulties they may face with their disease. So balance can be a bit worse. Patients are more susceptible to falling. Fatigue can be a problem. Cognitive difficulties also can be present. So it doesn't sound like such a rosy picture. That's the bad news. But the good news is that it doesn't have to be like that at all. We can counteract this. Number one, patients with MS are living longer with the disease. They're doing better. We're fortunate that there are disease-modifying therapies that have helped to slow down disease progression and have helped to also improve life expectancy with multiple sclerosis. Patients can expect to live a long life with multiple sclerosis. So we want to try to make the most of those years. So what can we do? There are 5 main things that I'd like everyone to focus on. Number 1 is exercise and staying physically active. Just keep your body moving. Our bodies were meant to stay in motion, whether it's walking the dog, stretching a little bit every day, doing the thing that you like to do and you want to do again. It doesn't have to be punishment. It's not supposed to be punishment. It should be something that you look forward to doing because there are so many benefits. Exercise helps improve cognition. It helps improve fatigue. It helps to improve your mental outlook and mood. So it's so important to do. And you try to stimulate yourself and try to push yourself a little bit more each day. So whether it's swimming, whether it's yoga, whether it could be taking the stairs instead of taking the elevator, whatever you're able to do, you want to try to do something on a daily basis. Look at the Fitbit, improve your step count. These are all activities that can help with improve your joint mobility, help to keep your muscles flexible, help to improve tone, and they all help to counteract some of the changes that can be seen with aging. So staying active is so important and key. Number 2 is if you smoke, stop. And if you don't smoke, don't even think about starting. Smoking, we know, not only is a trigger for MS disease activity, but if you have the disease, can make it worse. So that alone is a huge factor in keeping yourself healthy. Also, you want to try to maintain good health habits. Go for your yearly checkups, whether it's for women getting a mammogram done every year, going to see the GYN doctor and getting yearly pap tests done. For men, prostate examinations. The overall best medical health you can keep yourself in also helps with your MS disease activity. So if you're on a disease-modifying therapy, and hopefully you are, you should stay on it. You should be open with your doctor, with your nurse, with your healthcare team about problems you may be experiencing. Don't be afraid to communicate. It's so important to let everyone know how you're feeling, and if you're having problems, to try to do something about it. Take control of your health. That can make such a big difference in long-term care. Number 3 is proper nutrition, trying to maintain a healthy weight as much as possible. I think we all know what we should be eating and what we shouldn't be eating. The hard part is doing it. But small steps and small changes can make a huge difference in the long run. So eating more fruits and vegetables. Some of you have heard about having a colorful plate. The more colorful the food that's on your plate, usually the better it is for you. Lots of fruits and vegetables, lean meats, fish, lots of water. One of the biggest problems that often comes up, as for all of us as we get older, is not drinking enough. And so it's very important to stay well hydrated. By the time you find that you're thirsty, you're already a bit dehydrated. So keep drinking lots of water every day. Sometimes MS patients don't do this because of concerns regarding overactive bladder and having to get to the bathroom more frequently, but it is very important to do. Eating healthy, drinking lots of water, trying to maintain a healthy weight goes a long way towards counteracting some of the detrimental effects that can occur as we get older. It's also very important to stay connected and to stay social with one another. MS can often be isolating. Patients may not want to go out or to do things because of concerns of being a burden on others or slowing other people down, and they can become isolated, which can lead to increased concerns with depression. So we want to counteract this. It's important to try to stay connected to others, whether it's by joining a bridge game, playing mahjong, going to support groups, going to church groups, other religious organizations, to try to stay connected with one another. Have friends, reach out to family members, do things. Try to find an activity that you like and keep at it. Whether it could be ballroom dancing, going to movies with friends, going to coffee, grabbing a cup of coffee at Starbucks or Dunkin' Donuts, laughing with one another. Number 5 is having a sense of purpose. You want to have a reason to get out of bed in the morning, whether it's playing with your grandchildren, caring for a loved one, volunteering, taking part in a new hobby. And for many people, the ages after retirement are often a period where you can actually reinvent yourself and take up a new job or a new hobby that, whether it be painting, that gets you interested in doing something on a daily basis. You will never be as young as you are right now. And for patients with MS, the important thing to keep in mind is to take control. You have the disease, but the disease does not have you. And all these factors, maintaining a healthy weight, trying to eat the proper foods, the fruits and vegetables, lean meat, fish, drinking lots of water, staying connected with friends, exercise on a regular basis, and to the best of your ability. The person that you're competing with is yourself. You want to try to push yourself on a daily basis to do something. And that could be stretching. It can be trying to lift a 2-pound weight. It can be walking the dog, walking down the hallway, but to do it on a consistent basis is the most important thing. And maintaining your healthy checkups, staying on your medication. If you're having problems with your disease-modifying therapies, if you don't feel that you're responding to them, if you're having side effects, important to talk to your healthcare team about that. We want you to be able to stay on the proper medication. We want you to be able to treat the symptoms that you may be experiencing so that you can have a better quality of life. Remember, you have MS, but MS does not have you. My wish for you is to have the best quality of life possible. Enjoy your life. Do the things that you want to do. There will be obstacles, but you can overcome that, and we can do that together. So please keep that in mind and go on and live your best life.